Good evening and good to have you with us here on the Urban Debate at 8 p.m. Tonight, viewers, we once again talk about coronavirus. I know it's festival season. I know we're all tired. We've tackled this situation now for 8 months. The lockdown and post the lockdown, and as the rules have been relaxed, I know we're all tempted to go out, to shop, to socialize, to lead a normal life again. But let me tell you that as India's tally stands at the verge of crossing 87 lakhs, the country in some parts is seeing a surge in coronavirus cases again. For most of it, in the last couple of months, we have seen a downward trend, which is what has also emboldened a lot of us to believe that things are much better now. The government says 10 states, union territories reported about 78% of the new cases in the last 24 hours. But here are the few concerning points. The worst affected is our national capital, Delhi, that is actually seeing a daily COVID case load of about 7,000 to 8,000. In fact, for the first time ever in this COVID era, Delhi has reported 8,000 fresh cases in one single day, 8,593 to be precise. Not only that, even the daily death toll is going up. 85 deaths were reported in the last 24 hours. Now, as the situation worsens, the Delhi High Court has allowed the AAP government, the Delhi government, to go back to the reservation quota for ICU beds in private hospitals. So 80% of the ICU beds in private hospitals will have to be reserved for COVID patients. There was a stay on this decision, but in the light of the rising cases, now that stay has been removed. But Delhi High Court had some very, very serious comments to make about the handling of the situation. And the High Court said that the Delhi government can't be allowed to play with the lives of citizens. There is a complete change in the circumstances in Delhi, and that the Delhi government has to be much more alive to the current situation. Why are only 33 private hospitals chosen for reserving ICU beds? Why not other private hospitals? Why aren't they listed for reserving 80% of the ICU beds? High Court said the government's notification on COVID bed reservation is outdated. Let me give you a sense of why it is a bigger concern than ever before. Here is how things are different from June. Now, in the month of May and June is when the situation was at its peak, at its worst, across many parts of our country, including Delhi. But from there to now, if you see, it's worse now. For example, if in June, a week before the peak, there were about 397 cases being reported. And these are the deaths. The deaths in November, the week before peak, stand at 491. So there is a bit of a concern here, even if you see the daily cases in the month of June, between June 20th and June 23rd, the daily number of cases was in the range of about 2,500 to 3,600. But if I had to make the same comparison and look at 1 week in November, the cases are now hitting 8,500. That's the difference we are looking at on a week-to-week basis, whether it's the number of fresh cases or the number of deaths. That's not it. Even in the state of Maharashtra, the Maharashtra government and the health department has issued a circular to all of the hospitals and all of the district hospitals and the district administration to be alert, to keep the testing high, to keep a close check of what the government calls super spreaders, people who have higher chances of spreading infection if in case they're infected because they come across and they're exposed to more people. So yes, these two places, the state governments are on a high alert. What should you and I be doing? That's the big question. How prepared should we be for things to worsen from here? Are our governments really prepared to handle that kind of a caseload? Let's say good evening to the panelists who are joining us right now. Nitin Tyagi, spokesperson for the Aam Aadmi Party, joins us this evening. Dr. Sameer Dalwai, NCP spokesperson and a developmental pediatrician, joins us this evening. Dr. Saurav Basu, senior resident, Department of Community Medicine at Maulana Azad Medical College. Dr. Mahesh Chandra Misra, former director for AIIMS, also with us this evening, and Dr. Mangesh Pate, chairman of the IIMA Hospital Board of India and Maharashtra. He is also a member of the state and the national COVID task force that we have. Good evening to all of you. Thank you for joining us this evening. Let me actually start off by asking Dr. Mahesh Chandra this question. Dr. Mahesh Chandra Misra, to what? There are multiple factors that many experts tell us. To what do you attribute Delhi's current COVID crisis? I mean, we didn't even see this kind of a spike in cases and deaths, even deaths or serious cases in the month of May or June.
Yeah, I think you have to realize that we anticipated, we expected this spike, and we have been talking even on Mirror now that because of the festive season beginning in September end and October through and then November throughout, and then we are heading towards Christmas and New Year. So, Navratri, then opening up, it's a normal working, normal functioning now. Markets, you see, there is no place to put your foot there. People are just not, either they are fatigued or they are so careless that they don't care, as if the COVID has gone. Despite that, Prime Minister did come out on the national telecast and warned everyone that COVID is very much around. So that is something which is doing this damage to people. And then on top of that, the pollution, the temperatures going down, and also the basically it is just a I would say people not taking things seriously. Public transport opening up. And you see, everything is functioning normally. People are just not taking enough precautions, even if they are going to work or going to shopping. Markets are full, like as if like last year. And you saw the how much pollution, and then we were so much concerned about that last week. And this is all adding to the problem, and deaths are also related to that also. Basically it is also adding up number of deaths in Delhi, and there are now we are actually the government is also seems to be fatigued because there is no contact tracing, there is nothing, everything has been put to be sorted out on its own. I think we are on auto mode now, so whatever has to happen will happen. Those who will die, they die. Those who survive will survive. I think that is where we have reached in our country now. It has been left to nature, God, whatever you say, to tackle the COVID. People have are not just paying any heed to precautions. Simple thing, putting on mask and as much distancing one can maintain. But you see, metro, the travelers have doubled. We very emphatically said, please do not open schools. So it's good thing that schools have not been opened so far. That's a good thing which has happened. But if you see, it's a free for all.
Yes,
There is
absolutely.
no.
In fact, Dr. Chandra, if I can just take that point across to Nitin Tyagi and ask him, Nitin Tyagi, there is no denying that there is definitely a fatigue factor when it comes to people. And honestly, it's across cities, across towns and across states that people have now just given up. They want to get out. Some are still trying to at least wear masks. Social distancing is gone for a toss. But is there also a fatigue factor for the governments?
No, I don't think so. There's any fatigue factor for the government. Yes, indeed, it is a factor. Fatigue has set in. It seems people have become very careless about their social distancing. Even a lot of people are not very keen on wearing masks anymore. But in Delhi, we see a lot of people, a high percentage of people wearing masks. And definitely with markets opening up and this festival season, a lot of shopping happening. A lot of people and all the private offices, all the government offices, everything has been opened up in Delhi, and public transport has started. And yes, winter is setting in. The temperature, the pollution, every factor is counting. And yes, I think it's not very far off the target if we say that people are actually fatigued, but we are trying to communicate with the people on a very regular basis. Even the CM and all the local leaders and everybody is trying to communicate with the people and trying to remind them that it is very necessary that we do not become careless about our security during this corona times. And one of the reasons why we have been communicating with people is to keep on reminding them. Otherwise, yes, it is happening everywhere, not only in India, but everywhere in the world, that people are becoming careless and they are coming out in numbers. And I think uh, a lot of factors are to be taken into account when we talk about this sudden rise in, or the third peak that we are calling, that's happening in Delhi right now.
Yes, but the fact of the matter is that the High Court itself is saying that your own even beds reservation policy is completely outdated. And the Delhi government cannot be allowed to
It's
play with
not
the lives
outdated.
of
Actually,
people.
we it's not about see a lot of deaths that are happening. You already mentioned about the lot of deaths that are happening. It is mainly due to high comorbidities. There are some different ailments already with the people, with most of the people, in fact, more than 90% of the people. Corona is not the only reason why these deaths are happening. It is more due to extreme comorbidities. And yes, we need to take care of this pandemic right now, and it is a priority. So the government was very keen, and I think High Court was very kind enough to allow this 80% beds in 33 big private hospitals, to give reserve the ICU beds for the corona patients, the COVID patients,
Okay.
and for so I think that is going to help.
So,
And we are not short of beds. If even if there's a surge, Delhi government is prepared to help its citizen and all the people who are here suffering from corona,
yeah, I mean, the
and we
concern
stand
at
with
the
them.
end of the day, Mr. Tyagi, will only be, of course, for beds with ventilators and ICU beds. I think the problem right now is that the cases that are coming in, especially in the NCR region, are the more serious kinds than what we saw earlier. So, simple
Absolutely. And
regular beds
Delhi.
or isolation centers and all of those things are not going to be helpful. I will come back to you. I have three more panelists to go, but just to get a national sense as well, Dr. Mangesh Pate. Dr. Mangesh, is this a problem which is going to be only in certain pockets? Maharashtra also seems to be preparing for the worst, taking cues from what's happened in Europe. Should other states should also be concerned about the festival damage?
Uh, yes, Tanvi, definitely. Actually, the statements are coming from the government that appear that they are trying to make some preparation for the expected surge in the cases. The expectation in the surge of the cases is because of the festive season, number one, people coming together, not maintaining social distance, and whatever guidelines are given, they are not being obeyed at all. But one thing, this is many occasions I have been on this channel, and every occasion I have maintained my stand very much, very clear. In our country, the issue is the execution of the guidelines. We are very proper and this neat in giving the guidelines. These guidelines, how much they are executed at grassroots level, that there is no one to see. There is no vigilance. If you recall the month of April or May, that time you were not speaking of the ventilator beds. I was not speaking of the ventilator beds in the month of April. We were trying to relocate and locate the cases, new cases that time. We were speaking the language of the testing, isolation, tracing, all those things. And that time we had emphasized the importance of all these things. But what we have seen over last 7.5 months, the execution as far as the testing, isolation, the tracing of the contacts is concerned, we have failed in miserably on the execution part. Remember that. Giving guidelines from government side is the most easy thing to do. There are very nice people in ICMR and where all in governance and administration sitting. But when the guidelines percolate to the local administration, how local administration execute those orders, it all depends on that. People are there on the streets. I totally agree, and we are all are seeing that. And there is no place for exhaustion or tiredness in the governance or administration. There is no place for this for. That's what I feel.
Okay, let me ask Sameer Dalwai this question. And Sameer Dalwai, there are two aspects. One is, of course, we'll come to the contact tracing part in just a bit, but the implementation of the rules that have to be followed. Have governments also now given up? There's only so much. Is there a thought process that there is only so much you can tell people, and then it's really up to them?
Well, governments, being governments, have to do or at least appear to do what they need to do. Today itself in Maharashtra, there was a directive from the Director General of Health Services cautioning all health services, the government, especially health services, to be prepared for with a greater vigilance, expecting a surge in cases. Now that brings us to the issue which Dr. Pate, my friend, just now mentioned, that this is getting similar back to what happened in March and April. What does it mean? What it means is that it's going to be a surge in cases again, what we are seeing. Now the discussion about what's going to happen in the hospitals and how we manage these cases is not so significant today, because I think we are better at treating them in the hospital today than we were 7 months back. The real issue today is the huge explosion in numbers. Now look at the Kerala story. They had the best numbers possible after a time, at a situation where people got together and there were inflow of expatriates from abroad. Suddenly it has gone out of control. It's not being controlled right now. So we all need to take a deep breath, step back and realize that this is a virus. It's only a 8-10-month-old virus. Let's face it, we know almost nothing about this virus. And let's understand that we've been shooting in the dark, but now we are trying to get our target to be a little better. Now what happens also is, what we are ignoring is the psychosocial impact of this infection. All the papers, and there's one paper in the Lancet that has come out yesterday, which says that 1 out of 5 people with COVID are developing a psychiatric comorbidity. But what's even more interesting is it has said those with a psychiatric morbidity have a 65% more chances of getting COVID. So there is this interplay between the human psychology and the infection with the virus and
Dr.
succumbing to the virus.
Sorry, what do you mean when you say are developing a psychiatric comorbidity?
It's been found that 1 out of 5 patients of COVID have been now diagnosed in the next 3 months post-infection with either anxiety, depression or dementia. The percentage of strokes in people with COVID is much higher in those with people without COVID. So it's very clearly that. But what I'm also trying to say is that the study also shows people with a psychiatric problem are more likely to develop COVID. Now, what does that mean? It means there is a very curious interplay between the psychology during a pandemic and the actual virulence of the virus. What it means is, well, people are stepping out now, as somebody said, fatigue. There are also religions and festivals and meeting people together play a very important part in our life. One may not be looking at Diwali from a religious point of view, but certainly from a social point of view. You get to meet everybody else, you go out. After a long siege indoors for the last 7-8 months, people want to step out now. It's playing on their minds. There is so much of anxiety. They need an outlet. And that is what we are seeing now. But as somebody mentioned, we are not a population used to accepting measures very quickly. So there is some reluctance to wear a mask or to maintain social distancing. In UAE, for example, I was talking to a patient and he said, if you are seen without a mask, you have to pay 300 dirhams. And if you have a collection of more than 8 people in your house, you have to pay 30,000 dirhams. Now that is not something which may be practically possible in our country to be so punitive. So what I'm going to end by saying is, there is going to be this curious interplay between the virus and mankind.
Yeah.
Let's look at it from that point of view. And we have to do our best to prevent it, but it cannot be an absolute measure like another lockdown. Though UK has gone in for a second lockdown, India can't afford it economically as well as socially.
Yeah, I don't think anybody wants that, or even anybody is even thinking on those lines, and I hope we don't have to go there at all, which is why there are only 2 things that we should be looking at and we should be doing right now. One is, even if we have to step out, even if we have to socialize, we do it in smaller circles, we do it with all precautions. When we do step out in public places, we wear our masks and we follow the health and hygiene instructions that have been given. On the other hand, we also have to keep our testing high, our contact tracing high, and our preparations for healthcare at a high level. The governments cannot let their guard down on that aspect. Now, Dr. Saurav Basu is with me this evening. And Dr. Basu, I believe you were part of this one report that's been done that really collates data about the kind of infection and sero survey prevalence that we've seen in the national capital. Can you take our viewers through some of the interesting highlights that you've observed?
Yeah, actually, the Delhi government commissioned a series of sero surveys in Delhi from July to October of this month. So 4 rounds of sero survey have been completed under the leadership of Dr. Nandini Sharma, who is the Dean of Maulana Azad Medical College. So what we found was interesting was that the sero prevalence in July, it was nearly 22%, and from there it peaked as high as 29% in August. But since then it has declined, and we are now getting between somewhere around 25%. So nearly 1 in 4 are showing evidence of past infection. Now the important thing is that in evidence from even international studies like in the UK REACT study has shown that antibodies tend to deplete over time. So we cannot be certain that this is the peak that we have reached. Probably the peak could have been even higher as far as infection goes. And what we found out was a departure from the national sero survey conducted by ICMR. In our study, we found that women had a statistically significantly higher risk of having past infection, especially women over the age of 50 years. They had a higher prevalence, sero prevalence of infection. So this was an important aspect. Diabetes patients, it is already well established, they are at once they contract COVID-19, there is a higher risk of morbidity, more severe disease in diabetes patients. But what is interesting is they also have a higher proportion of diabetes patients also have antibodies, which was found in our sero survey.
No,
now,
so,
the thing is
so Dr. Basu, let me just ask you one question that comes to my mind. Effectively, the sero survey prevalence that you're talking about, and the last month gone by says a quarter of people showed signs and had antibodies, a sign that they had been infected at some point in the recent past.
Yeah.
Obviously, that's not reflected in the COVID cases that gets registered. So when we sit and talk now and say that infections could go up, more people could be getting infected now, should we really be as concerned? If you're saying a quarter of Delhi's population already got infected and did not have that damaging effect, should we then be so concerned?
Yeah, because the total population is huge, and apart from that, we do not know how protective are these antibodies, because there is a possibility that some of these people who had antibodies, they may in future develop infection, especially the asymptomatic cases who never had any evidence, who had never been diagnosed with RT-PCR or the antigen methods. So we are not certain that if you have an antibody, you are never going to develop any COVID-19 in the future, maybe 3 months from now or 4 months from now. So although there are other forms of immunity, the T-cell mediated immunity, which also provide immunity. So we cannot be absolutely certain. So we have to maintain all precautions irrespective of what percentage of the population has antibodies, because right now we are still in the dark as to what is going to happen in the future, how many of these people are still vulnerable in spite of developing antibodies at a certain point in time.
Okay. Dr. Dalwai.
Well, as Dr. Basu so eloquently said, we must understand there are two aspects that confound all these scientific studies. One, there is something called asymptomatic infection. You may have been infected, but you never knew about it. You didn't have symptoms. Correct. Second, not everybody who has got infected has developed these antibodies. Now, when you make a population study, you have no clue what's happening. There must be somebody who has been infected in the past who probably developed antibodies. We know that these antibodies almost evaporate within 3 to 4 months. And now the infection that is getting admitted in Delhi or Maharashtra with is actually a reinfection. We don't know. We don't know this. It was not the first infection. So technically, there is no real belief of first wave, second wave, third wave. And hence what I'm trying to say is, it is virus and mankind. The only plea that I have to make is, let's understand this virus does not divide on political or religious or any other grounds. So what's very important is we have a scientific body trying to establish some ground rules that we can help people with. It's very important not to get into politicking and picking on this state and then that state, that today
Sure.
this state, there are more numbers. And that is what we should be avoided. Similarly, when it comes to festivals or religion, one must keep the two aspects separate. The social inclination of a person to get out of the house and meet people is important.
Yeah.
But we must not bring in another angle which then puts the governments on a back foot. That's very important for us to understand as a population.
No, the other angle can vary. It's just a factor. It's a factor that was a challenge for Kerala, say a month ago when it was festival season there, and they did see a spike in cases. It's about asking whether the governments are prepared to handle it, whether they know what's coming next. For example, if Maharashtra is already preparing for what they think will be a bad time or a tough time in January, then that's required. But while they do their high level of testing, do they also do their high level of contact tracing? That's something that is correct. As one of our panelists said, most governments have given up on. We are unable to absolutely catch up on contact tracing when cases are being reported at such a large scale. Now, the second aspect, and I want to pull out visuals that we captured this evening. This is of course now a daily routine for many in our big cities, and more offices open up and more people step out to travel. This was a kind of a queue that we caught outside the Rajiv Chowk metro station, and here you see people moving, and Alok, our reporter who was there, just continued to walk for a really long distance, and that queue just goes on. He also spoke to some of these people, and they said that, well, yeah, this is a daily routine, and inside the metro station there is a lot more chaos. So Nitin Tyagi, the point that I'm trying to ask you is there an understanding that a lot more needs to be done to step up public transport in the city? We can't be pushing private transport right now because pollution is a huge challenge. But how do we address that there isn't chaos that unfolds in our metro stations and metro trains?
Definitely, there need to be more care in the public transport system and definitely public transport system opening up of metros and filling up of the DTC buses. I think they have added to the spike, definitely. But that is how Delhi is, and we are trying to augment the public transport system in such a manner that, yes, we can actually go for social distancing even in the public transport system. And it is definitely one part that we make people aware and we keep on reminding the people of the social distancing norms and the safety measures that they have to take during this pandemic. But there's one more thing that, yes, people also need to participate in this act. And see, you've been seeing all these market areas where a lot of people have gone for shopping, and there's such a huge crowd, and everyday pictures and videos keep on popping out where there's a huge crowd in a market, and everybody is blaming everybody else. But this is what is happening everywhere in this country, and you can't actually have a gun at anybody's head all the time. And people, that is the fact that everybody I think in the panel is picking up, that people are actually fatigued right now. And we are talking about having different office timings so that these commuters that you see in a line can actually be divided into different time slots. And I think that is going to help, and we are working on that. And major reason that you see a huge spike in Delhi is very aggressive testing on the contact tracing.
Okay, is the contact tracing still on? We often get many viewers who call us up and say that the contact tracing is really not up to the mark. I've heard personal stories of people to say somebody contracted in their own family and nobody came about to check or follow up with the people in and around that place.
That can be a one-off story. I can't say, but in maximum number of cases, in a high percentage of cases, there's a very aggressive contact tracing up to 10 to 15 people, and people are coming in bulk. See, we have almost 4,000 hotspots in Delhi right now, and that is because of contact tracing only. Because when we see a proper locality where 2 or 3 families have these positive cases. So we declare it as a hotspot and we take care. And the whole area is actually cordoned off and people are tested in that area. And that is one of the reasons why there's such a huge spike in the positive cases that you see in Delhi.
Dr. Mishra,
very aggressive.
let me
contact
just Nitin bring in Dr. Mishra also. I think
definitely.
he has a view on this. Yeah.
Tanvi, it's just not possible to do contact tracing now. Whatever Dr. Nitin may be saying, it's his view, but it's a widespread community transmission today. You see, every house has cases, not 1, 2, 3, 4, 5. Home quarantine has worked in Delhi. That's a good thing. So they did not require too many hospital beds in between. But now, suddenly, when this spike following Navratra and Dashera has happened, and we must be prepared to embrace post-Diwali. The whole November will be chaotic. I can tell you that. And that is something we must be prepared and want public to maintain as much discipline as possible. That is the problem with the public also. We cannot just put everything on the government. Public is also responsible, and public, this is urban public. These are padha likha log jo they are not listening at all. And that is what creating more chaos, more problem, and ultimately they are the sufferers. We may keep blaming the government, we may keep blaming MCD, NDMC, central government, state government, but who is the sufferer? Sufferer is we. If we do not take precaution, we do not care ourselves about our health, then nobody will come to our rescue. Whatever we may say, we may give figures, we may give studies in Lancet, it will not help. It is not going to help. Every pandemic has 3 dimensions. The medical one, which is now much better understood than what was in March. The other one is the psychosocial, which I think Dr. Dalvi touched upon by the Lancet study. It is very much there. But then we have to have, like I keep counseling people. I write first thing, if you have contracted infection, no panic. You will be all right. And 99% people will be all right. People must take it that way. The only section with the comorbidities, elderly people, higher age group, some of the youngers we have also lost. Our doctors, we have lost a lot of doctors who were young. So it is not that something, so that is something we have to reassure public, and this is the protocol they have to use. Keep checking your oxygen levels once you have contracted the disease, particularly with comorbidities, particularly if you are more than 50 years of age. I think all those things have to be done, but we cannot underestimate and underemphasize the importance of prevention. That is still no vaccine, no definite treatment. Mask is the only thing on everyone's face, and maintaining as much distance as possible. I think that is something can bring about a lot of prevention and may not require a lot of hospitalization, etc. So I think contact tracing is, you forget about it. In India, it never happened properly. From March itself, it did not happen. If it had happened in March itself, where a plane load of people were landing in India and lost in the public and nobody could be traced. From aeroplane, 200 passengers in Punjab, only 10 passengers could be traced in March.
Correct.
How can we trace now? This is just impossible to trace anybody. So much community transmission.
Okay, so on one hand, we have Dr. Mishra who says that people need to be taking a lot more precautions. There's no other way. It all can't be put on the government. Yes, there is a larger impact. That's a psychological impact that happens, and many people are completely fed up. On the other side, Dr. Salmi Davai says that gradually people will have to step out. We can't stop them from doing that. We can't stop them from socializing.
Yeah,
That's also required. Yes.
We cannot have that kind of an attitude. Actually,
now 20th November is a big marriage day in India. Lot of marriages are taking place. I have got 3 or 4 invitations. I have replied to every invitation. Please create a web link for attending that marriage. I am not going to come in person in that marriage. Even if you have allowed 100 persons, like in advisory, who is going to count whether there are 150, 200 or 500 people there?
No,
and then you food there.
Absolutely.
You will mix talk. So we are heading for a disaster if people do not listen to these advisories. And I have advised on many other advisory panels where I am that please discourage marriage gathering, except the very close family members should be in the marriage
Well, I don't know
ceremonies.
how that works, especially, in many parts of North India, definitely Delhi. I mean, Delhi weddings are infamous for their scale and their style and this, size. So you're right, Dr. Mishra. So Dr. Mangesh, where do you stand on this? On one hand, there is a festival season, wedding season, and fatigue factor. On the other is the possible disaster that awaits us.
See, I completely agree with Dr. Mishra, sir. I just want to add a few things to that. Before going to that, I want to speak on this channel one very good thing Dr. Mishra spoke about. He received 3-4 invitations himself and he said, kindly arrange for online marriage and don't make chaos in the, and very nice thing. If Dr. Mishra can do this, why governance cannot do it? Administration cannot do it. A simple thing. And it is not at all difficult. That's why what I said, fatigue, this word does not have a place in the dictionary of the administration and the governance. We are failing there. Now, as far as the testing is concerned, isolation and the tracing of the contact is concerned, whatever stage of a pandemic we are, at the down 7.5 months, we just cannot do away with these things. But what we have seen in month of April, May, June, July, same thing we are seeing today also. I challenge you, come out with your cameraman with me. I will show you 100 cases minimum that those who suffered from the COVID or suffering from the COVID and no one in their family is contacted by the administration. This is regularly happening everywhere. We are just speaking of the big things. We are doing this, we are doing no. We are a failure as far as the tracing, contact tracing is concerned. Isolation, how much vigilance are keeping about the self-isolation, whether people abiding by that. As Misra sir mentioned about the marriage now in Delhi, in Mumbai, I have examples in the month of April, there was a marriage where 1,500 people attended 2 consecutive days. And so many patients have come out of that marriage. Where is administration? That's why I say that giving guidelines is the most easy thing. But as far as these things, execution is concerned, we have to catch hold of the local administration. It may be state government or it may be central government. They have to see to it that the local administration, they execute very strictly whatever guidelines are being given. Otherwise, giving the guidelines has proved futile and useless over the last 7.5 months. And why we have reached to this stage is only and only because of the failure of the local administration.
But Dr. Mangesh, look at the visuals we are getting from across the country, and I can bring you visuals from Chennai, Mumbai, Pune, Bengaluru, Hyderabad, Delhi, Lucknow, Kanpur, across the country, Dr. Mangesh. The visuals show a completely different story. None of the administration officials are able to do anything.
Tanvi, can I just come in?
Yeah, Nitin, coming to you next.
Yeah, I am also seeing your visuals right now. And that we see live every day, every one of us, all panelists. That people are just not listening. But as I said, there is a way to how to go for everything. Now in Maharashtra, what they have done for the local trains in Mumbai, you cannot travel in Mumbai so easily. For local trains, common people are using what they have done. They have created a QR code. They are giving limited entries. Like all these things should be done in everywhere where gathering is happening. Now, in last 24 hours, I am hearing somewhere in Maharashtra, they are thinking of opening the schools. What is government administration thinking of? If you open the school, what has happened in the Britain and Europe, we all are aware of that. And if we speak of this language of opening up the school now completely, what is going to happen tomorrow? Who is going to be responsible for this? So what you are showing on the television everywhere, yes, people have to go out for the work, agreed. But what administration has to be done? Suppose local railway station is there. It is very easy to administer. There are 4 entries for any local substation. You just monitor those entries, very easy. But it needs a channelized administration where we are failing.
Okay,
And
so
then
I have two representatives of two different places and two different governments. Let's get them to respond. Nitin, make your point and respond to what our experts are also saying, and then Samir Dalwai.
I'll say something. I agree to what Dr. Mishra was saying, but let me tell you, you say that contact tracing is not possible and it's not happening and we should not go. But that is the exact fatigue that we are talking about. Any government, no government should feel fatigued about this pandemic right now. And we have to keep on with the contact tracing. And at least you cannot find everybody, but no matter how many people you find, you have to go about it. One thing. Secondly, yes, people will feel fatigued, and governments should stand with the people. There would be spikes, and there would be times when the surge goes down. But at any given point of time, people should feel confident that if in case they contract this disease, they get this disease, they catch the virus, they would be taken care of. That is the kind of confidence that the people should have in their government. These are the factors that set Delhi government apart. And I think this is the kind of confidence that people in Delhi have in their government right now. And we have been talking about this since before Navratras. That's yes, festival season is coming in, and we have to be prepared for this surge. And I think you all will recall that every single leader, including the CM, the health minister, or our panelists, have been talking about it. That we have to
do you think
prepare
that,
for
Nitin,
after the festival. We understand that people will go out on the streets. People will socialize more during this time. And let me tell you one more thing. I'm a politician. I get more invites than probably a lot of people. And I do not go to all of them right now. We have to also pick and choose right now because of the corona thing. And people are aware in Delhi. People take precautions. They are inviting very few people. And most of the weddings that I have been to, there have been just 50 people or 100 people maximum, not more than that. And I think that is a good sign if people are taking
let me ask you
responsibility.
this. You say we are ready and we are preparing. We know this will happen. Tell me, is there a need to then increase the number of hospitals, even private hospitals, where beds are being reserved, ICU beds and ventilators are being reserved?
The number of beds. We have increased number of beds, not only in the government hospitals, but in the private hospitals also. Over 500 beds in the government hospitals and 585 some beds in private hospitals have been increased, looking at the surge that is going to happen. And this is why we had gone to High Court to help us get this 80% reservation in the ICU beds in the top 33 private hospitals of the capital. And we have succeeded in that, and we are very thankful to the High Court for giving this kind of judgment. And we are ready for this pandemic.
Okay.
And there is going to be a surge till after Diwali. And
I hope when you say you are ready, you know what you're talking about, and we don't have to have another conversation when cases do go up. Samir Dalwai, go ahead, please.
I mean, this is a fantastic debate today. On one hand, I agree with my dear friend Mahesh ji when he says whatever he said is exactly what the medical association has to say, because that's what is the science behind it. And he's perfectly right in pushing for it, because if he doesn't, we won't get anywhere close to it. On the other hand, Dr. Misra, sir, I respect what he said is the practicality of it. And between the two, we will have to find the golden medium. And hence, I'd like to say 2 points, one from each of what they've said. One, let's please understand that let's not have a political divide on these issues. Let's tell all the political parties not to pick up political points that why aren't you starting, well, you started bars, why aren't you starting religious places, what about, so let's not do it as a political religious issue at all. That's the first part. The second part is about public health. Public health is by definition, of course, the government has a very important role to play in it, but also the public has to play a role in it. And I salute Dr. Misra when he says on camera that I received 3 invitations, but I have told him, sorry, I mean, I wish you all the best, but I'm not going to come there in person. My best wishes are with you. I think this is what people like him have to send the message out, and everybody has to understand that today I have to take care of myself and my family, and the simple things I can do is wear a mask, social distancing, and if it's not very necessary to go in a public gathering, I need not go. It's as simple as that, and I'd like to commend all your panelists today for having really, and especially Dr. Misra, for having shown us the real way ahead, to be practically conscious about what you can do as a citizen who's aware.
Okay, but then now tell me also, Samir Dalwai, also how do we prepare? Yes, like you earlier said, a circular has been issued to the district authorities and the district hospitals, but do we need to step up on our ICU beds, ventilators, relook at the tracing strategy or better implementation? I mean, nowhere in Mumbai do I see any kind of implementation of rules.
Well, if you see the numbers of the cases detected may increase, but the mortality is definitely going down. And that's because when it comes to mortality, it's largely to deal with the medical system, whether it's government or private. And I think they're really getting their act together in terms of what really helps. I don't want to go into the medical drug discussion of that. But what's equally important to understand about contact tracing, of course, it's happening. I'm sure there must be glitches in it. It cannot be 100%. I'm sure I agree with Dr. Pate when he says that. But when you do contact tracing today, you don't even know whether that person who is a contact has been previously exposed. Does he have antibodies? Does he not have antibodies? So what I would think is that we have a better way of managing the cases today. But what is more important is for each one of us as citizens to understand how we can take care of it. Also, we know today that if there is home isolation, like Sir Dr. Misra mentioned, you have to keep monitoring your oxygen, you can keep monitoring your temperature. And there are so many things people are aware today about what they can do. And it's very important not to panic. I think these are the things that are really going to take us through this very difficult phase that's going to come up now.
I have one question, and since I have so many expert doctors on the panel, let me ask them. Dr. Mangesh, take a look at what's happened as far as crowding is concerned. The large size rallies that we've seen held across the country, and this is not really a political question. I mean, irrespective of the parties, almost everybody did it. We held voting where we found in many places that absolutely no norms were being followed. We've seen celebrations, in political celebrations and large scale gatherings that have happened where no norms have been followed. Yet if we look at the numbers, they don't seem to be showing a jump in cases. Now, is it that in certain parts of our country like Bihar, people are just a little more immune to this, or we are not testing enough? What's going on? This is a question I often get asked.
I also received this question from many facets of the corners of the society, definitely. But instead of going into details whether those people in Bihar, they are more immune or whether the things are being hidden over there, I will not like to enter into this. But what we stand, that the testing, tracing, contact tracing, isolation, these are the things which is on the part of the administration. These has to be meticulously followed by the government, may it be Maharashtra, Delhi, Bihar, all across the country. And secondly, masks, social distancing, and hygiene. These are the things on the part of the people to follow. This is very important. And today's date, in this discussion, a couple of occasions, it was mentioned that are we ready or is government preparing for the surge of the cases? Are the beds available? Are the ventilators available? And whatever notifications from the government are there, they are not really useful today. It's been spoken. Let me ask you a simple thing. Last 7.5 months, who has stood for the people of this country? It was the private sector hospitals. If after 7.5 or 8 months, we are again speaking the same language of availability of ventilators and beds, then what is the government functioning? What is the government doing? Today, private doctors still are managing, but unfortunately, let me tell you, all my colleagues here in the panel, they are doctors too. We have lost more than 550 to 600 doctors across the country fighting COVID. They all were working in the COVID. They were COVID warriors. They have treated thousands of people in the country. But after their death, government has not stood behind those doctors. I have an example of a doctor who has got 8 months old child and a young wife who died. Neurosurgeon he was. And after his death, government has rejected his insurance. We are not standing with the families of the doctors who are martyrs. You tell me, after the surge, what we are expecting, you are again looking for the private sector to stand with you? 100% doctors will stand for the people, each one. Everyone in this panel also will echo my feelings that we will stand for people. but not with very good feeling for the government. That much I will like to note here. Thank you.
Well, that's a very pertinent
Tanvi,
point you've made, Dr. Mangesh. In
Tanvi,
fact, quite often we've raised that point that while there is a lot of rhetoric of standing by the COVID warriors, how many governments are actually able to do it on ground? Schemes that have also been announced don't get implemented. Dr. Misra, if I can come to you on the point that I raised as well. And I ask this question simply because it's also often cited as an example कि देखो वहाँ पे तो इतनी भीड़ थी, इतने लोग आए गए, कुछ नहीं हो रहा, ये सब डराने की बात है।
नहीं तन्वी, ये बिल्कुल ठीक नहीं है। एक बात जरूर है कि हमारा रूरल एरिया अभी भी उतना बैडली अफेक्टेड नहीं है कोविड से जितना अर्बन एरिया है। एक ये बड़ा डिफरेंस है बिहार की रैलीज का। दूसरे, जितनी भी रैलीज थी उसमें यंगर पॉपुलेशन है सारी। आप देखिए रैलीज में मेल्स हैं सारे यंगर, राउडी क्राउड्स। उनको कोविड वैसे हो भी जाएगा, पता नहीं लगेगा, निकल जाएगा कोविड होके। टेस्टिंग तो हो नहीं रही वहां पे। मैं आपको एग्जांपल अभी यहाँ पे नहीं बताऊंगा, बट आई कैन टेल यू कॉन्फिडेंशियली, डिस्ट्रिक्ट मजिस्ट्रेट्स हैव स्टॉप्ड टेस्टिंग, केसेस बढ़ जाएंगे और फिर सीएम उनको पुल अप करेंगे। तो आप ये अंदाज लगा सकते हैं, भारतवर्ष तो हमारा महान है, इसमें कोई शक नहीं है, लेकिन और दूसरी तरीके से भी महान है। ये भी आप हम सबको पता होना चाहिए कि किस तरह से लोगों ने अवॉइड किया है टेस्टिंग करने को कि केसेस बढ़ जाए। और आज भी जो थोड़ी सी कंट्रोल दिखता था उसमें काफी टेस्टिंग इतनी प्लेटो थी, टेस्टिंग बहुत ज्यादा नहीं बढ़ रही थी स्टेट्स में। बाकी स्टेट में दिल्ली की टेस्टिंग सबसे ज्यादा रही है, दिल्ली का रिकॉर्ड भी अच्छा रहा है। इन बिटवीन थोड़ी लैक्सिटी थी, बट दे अगेन regrouped and came back. So Delhi testing has been the maximum, then I think Tamil Nadu, then Maharashtra, and then other states. But India is a large country, हर स्टेट का अपना पीक होगा, अपना डिक्लाइन होगा। एक साथ सब जगह ना डिक्लाइन होगा ना पीक होगा। केरला, छत्तीसगढ़ are doing very well until May, June. But then now Kerala you see what is happening, Chhattisgarh you see what is happening, Madhya Pradesh you see what's happening. So I think India is a large country. Every state will have its own peak, its own plateau, and every state has done remarkably well, I would say. There are deficiencies. We can't say things are ideal. They are far from ideal. But in no country, developed country with best of healthcare infrastructure, things were not ideal or they were not optimal. In Europe, we saw how much chaos. In Italy, there was. In Spain, there was chaos. In USA, there was chaos. In UK, there were. But good thing in these countries was, like UK, they had a very strict guideline who will go into ICU.
Right.
हमने बेड रिजर्व कर दिए, बट क्या हम कोई गाइडलाइन बना रहे हैं भारत में कि हमारा कौन सा पेशेंट सैल्वेजेबल वाला जाएगा आईसीयू में या नहीं जाएगा? वहां पे अगर सैल्वेजेबिलिटी नहीं है, कमिटी ने डिसाइड कर दिया वो पेशेंट आईसीयू में नहीं जाएगा, ही मे बी वेरी सिक, but that patient will not be taken to ICU. And I would agree with Dr. Mangesh, private sector has stood shoulder to shoulder with the government, and in some governments, like I know कि उनको ICU का कितना चार्ज मिल रहा है, पेमेंट नहीं आ रही है गवर्नमेंट से. These are the issues which nobody wants to talk about.
You are right. I mean, it broke my heart, Dr. Misra, when we had, the healthcare staff members, nurses and doctors protesting in the national capital because they had not been paid salaries for 3 months. I am out of time, but very quickly, Dr. Vasu, do you have a view as well on this?
Yeah, the final point I would like to make is, after all the eminent speakers have spoken, that we should also focus on, from a public health perspective, we should also look at the non-COVID conditions, which are going to increase during the winter months.
Yeah.
Like cases, those who need emergency care, like the people with myocardial infarction. So they should also be getting the beds. They should get the people who need dialysis, because during the initial part of the lockdown, these patients suffered a lot, like those with chronic kidney disease, those who were requiring emergency treatment. And even now, this problem can again emerge because of the increasing cases or the beds being booked for the COVID, being reserved for COVID. So we have to also have a plan for non-COVID conditions. It should not be that the people having non-COVID conditions suffer because of the spike in the COVID cases. So there should be planning for that. We should be having a plan of action for having adequate number of beds for non-COVID conditions, which are also expected to increase during this winter months.
You know, that's a very valid point that you raised, because the last time around when the cases were going up, what we did was we shut down a lot of other healthcare services, a lot of other crucial treatments, and all our focus and energies and resources were going for COVID cases. But we can't keep doing that repeatedly, and that can't be, you can't keep asking other patients with other very crucial illnesses and ailments to just hold on for another few set of months. So an important point, Dr. Basu, that you're raising there, and I hope that the governments also keep that in mind when they prepare for a possible surge or the surge that we are witnessing already in places like Delhi about this angle as well. Completely out of time. It's been a pleasure to have all of you panelists for joining us right now. Viewers, it's at the end of the day also our decision. At the end of the day, it is up to you and me and our families and friends and colleagues to decide whether we want to take this situation seriously or not. It may feel like we are, the COVID's gone away. It may feel like it's not a big challenge anymore. It may feel like we are tired of it and it doesn't matter anymore. Let's just go ahead and try and lead our normal lives. But do keep in mind that tomorrow, if the cases suddenly in every city or state go from 5,000 to 15,000, that pressure on the infrastructure will be humongous. And at that time, people who do contract COVID and do need medical care or hospitalization, they and their families will go through hell. There is no other way to put it. And so then it is up to us to decide whether we want to be one of those people, one of those patients, or we want to take more precautions today and avoid getting into that situation. Thank you so much for joining us on this conversation.